Hello again, Mrs. Lewis. I would like to discuss something that is difficult to talk about, but that we ask everyone who stays with us in the hospital, no matter their age or health.
Oh my, that doesn't sound good.
We do not expect this to happen. However, we need to know what you would want us to do if you were to get much sicker so that in this unlikely event, we can give you the treatment you want. There are several treatment options that I would like to discuss with you, and each has different negative consequences. The acceptability of these risks are different for each person. Have you ever thought about the kind of medical treatments you would want if you were to get sicker?
It's a bit of a morbid question. But I've been in hospital a few times and you always ask it, so I have thought about it a little, but am not really sure what I want.
That's no problem. There are two parts to the discussion that I would like to tackle separately. The first is about if we were to walk into your room and find your heart not beating and your lungs not breathing. That means you have passed away naturally. There are two options in this case. 1. Understand that you have died either from your illness or another unexpected event and allow you to rest peacefully. Or 2. Attempt to bring you back to life with aggressive and heroic measures including CPR and life support. This treatment plan means breaking ribs, placing a breathing tube in your throat, shocking your heart with electricity and transferring you to the intensive care unit on a ventilator. On average, out of every 10 people that receive this treatment, 1 to 2 will live to be discharged from hospital, and all of those will experience some level of functional decline, meaning you won't be as well as you were prior to this illness.
Oh my gosh, nobody ever told me those details. Knowing that information, I don't think it's something I would want.
Okay, I understand, and that seems reasonable. The second part of this conversation is about if your illness is getting worse in hospital and our current level of medical care is not enough to get you over your illness. There are different levels of invasive care that we can provide, from intensive in the ICU with machines breathing for you and medications supporting your blood pressure, all the way to only offering medications related to symptoms without any goal of prolonging life. These options, and all those in between, have pros and cons, and which level of care you choose will depend on what your priorities are. Mrs. Lewis, is there a state of health or functioning that you would consider unendurable?
I live at home by myself right now, and that is extremely important to me. I think that having to go to a nursing home or coming in and out of hospital a lot would be worse than dying. I've had a good life, I'm 81, you know. Considering what you just told me about your priorities, what do you think about the level of care you would want if your health were to worsen while you are in hospital? Well, I'm pretty sure I don't want to be on life support, but I would like to continue with other treatments. Sometimes when people don't want to be on life support, we have less invasive options that we can try. We can use medications such as antibiotics by the IV or by mouth, machines like BiPAP that support your breathing while allowing you to be awake and alert, and generally avoid treatments that can cause pain or require sedating medications. With these treatments, we attempt to minimize short-term suffering while still treating your acute illness. Additionally, since you are able to communicate with us while receiving these treatments, we can include you in all treatment decisions. That sounds reasonable. I would be okay with that.
Okay, I'm going to repeat my understanding of our discussion, and you let me know if my understanding is correct. If we were to find you passed away, you would want us to leave you be. And if you were getting sicker, we would not go to the ICU and we would not put you on life support. Otherwise, we would continue with our treatment plan.
That sounds like what I want.
Also important for you to know is that if after reflection or discussions with your family, if you change your mind or have questions, we can always revisit the conversation. If you are interested, we do have a patient information pamphlet that I could give to you that outlines some of the issues we have discussed.
Great, thank you.
You're welcome, Mrs. Lewis. I'll come check on you later.